Good morning. Welcome. It's Thursday, October 7th. Welcome to The Doc is In. This is where you get to ask Dr. Allison Arwady questions about COVID and vaccine here in Chicago. And we want those questions because we want you to have the facts. And we want you to know your data. You can send questions to us through Facebook or Twitter using the hashtag AskDrArwady. I'm very happy to be here. I'm Sybil Madison, Mayor Lori Lightfoot's Chief of Staff, and this is Dr. Allison Arwady.
And can I just say, I'm very happy when you grace us with your presence. We've been doing Facebook Live here for, goodness, 19 months at this point. We still do it twice a week. And, Sybil was my very regular partner for a year probably
and
of that
like,
plus.
Wasn't it every day?
Oh, we were doing it every day at the beginning. Every single day, 7 days a week at the beginning. And then we backed off to 6, and then we backed off to 5. But we've done this a whole lot. And so I love it when you take time out of your extremely busy schedule and come back. So thank you.
A little piece of nostalgia. Yeah. I get to dart over here.
Absolutely, absolutely. We get to check our distance.
Both fully vaxxed and get to hear the latest data.
Absolutely.
From you.
All right, thanks. So let's take a quick look at the dashboard. I've got a couple of slides for you, and then we'll jump right into your questions. As always, chi.gov/COVID- is where you find Chicago-specific COVID information. Just the very top line here, we're stable on cases, averaging 362 a day. You see that's compared to 360 a day last week. Below that 15 per 100,000 cutoff. Happy to see that. Hospitalizations also stable, 26 a day compared to 27 new Chicagoans getting hospitalized with COVID every day a week ago. Between 3 and 4 deaths a day, that's down a little bit, which we're glad to see, kind of getting over some of that Delta peak. Vaccinations are up, doing almost 5,600 a day. Some of those are booster shots, but every day we're seeing thousands of people still making that decision to get their vaccine series started, and we're happy about that. Testing numbers look great. We're averaging over 20,000 tests a day, the most we've ever been averaging throughout all of COVID. And in that setting, our positivity rate remains excellent, 2.2%, the lowest it's been since beginning of August. As a reminder, up at the top here is where you can look if you want to see what's happening by age or race, ethnicity, or gender, or at a particular time for cases, hospitalizations, and deaths. If you want to see what's happening in your zip code, if you want to see what's happening with positivity or testing, again, age, gender, race, ethnicity, everything about vaccines, you see. We're really pleased. These 12 to 17-year-olds are almost caught up to the 18 to 29-year-olds. We've got 63.9% of 12 to 17-year-olds having gotten at least that first dose. Next is the 18 to 29-year-olds at 65%. And then those 80 plus I'm still concerned about at 66.8%. That is not vaccinated enough, especially in that most concerning age group. So, feel free to explore here. You can see the percent vaccinated over time. And then finally, the vaccination by zip code. If you want to look at some details, you can use this slider here to see what your zip code looks like. And as a reminder, we're trying to get every community area as vaccinated as possible. We've got a goal of the city hitting at least 77%, named for our 77 communities, 77% of eligible people by the end of the year having had at least their first dose, and ideally having completed their vaccine series. And you see we're getting there. 73.6% have had at least that first dose. 67.5% have completed their vaccine series. So making some progress, and I shared on Facebook on Tuesday the details by community area. All right, I also just want to show a couple of other things here quickly. Sorry. Okay. So just in terms of where are we in our community transmission and risk matrix, you see we're sitting in that substantial risk still for cases, down from high, but in the middle of that substantial transmission risk, and the rest, our positivity, our non-ICU, and our ICU occupancy are all still at that lower level. So that's quite good. Just a quick reminder, there's a whole lot of questions coming about boosters, so we're going to hit those quickly. But just as a reminder, at the moment, boosters are only for people who received the Pfizer vaccine, and you should get that booster at least 6 months after your second dose. of the Pfizer vaccine. And the people who absolutely, we recommend getting a booster. You should receive a booster if you are over the age of 65. Full stop in the city of Chicago. If you got Pfizer and you completed that first dose at least 6 months ago. Also, anybody living in a long-term care facility who got Pfizer, people 50 to 64 with underlying medical conditions also should definitely receive that booster. And then you see people over 18, either who have underlying medical conditions or who have increased exposure at work, also are eligible and may receive the vaccine. And that depends a little bit on your work setting and your underlying condition. But for those top two groups, really want to see people be getting that booster shot. It helps protect people where we have seen some more of the breakthroughs. That's particularly for that group. Looking ahead, some people are also asking, what if I got Moderna? What if I got J&J?
Yes.
And we'll hit some of that. So October 14, the FDA's advisory committee will start considering Moderna booster. So I would expect by, a week or so, a week or two after that, we should have guidance for people who got Moderna as their first series. And similarly, J&J, probably they'll consider these, I would guess, together. So I'd say just in the next week or two, we'll have, or not week or two, but few weeks before the end of October, I would expect that we would have guidance. And I would also expect that that would be at least 6 weeks after 6 months after your primary vaccine series. Both Moderna and J&J started later than Pfizer did, and so this timing works fine. And then exciting that October 26th, the FDA Advisory Committee will begin considering the Pfizer vaccine, the primary series for 5 to 11-year-olds. And people probably have questions about that. There was some news today. Chicago.gov/flu is where you can see where to get flu and COVID vaccines. Again, this is the combo you don't want. That's what we're using for our marketing here. We're you like that, right? We're starting to see a little bit of flu, so don't wait. Get your flu vaccine. And then on Chicago.gov/flu, you see, for example, some of the community clinics that CDPH is running at different aldermanic offices, different places around Chicago. These, today we're in the 5th Ward and the 9th Ward at those locations. You can register. You can also walk in, but pharmacies have this, doctors' offices have it. It's widely available. There generally is not a cost or a copay, and I strongly encourage you to get your flu vaccine. And then if you're eligible, in many locations, you can get the COVID booster at the same time.
And this is, I imagine, really important because last year, if I recall correctly, flu was kind of quiet.
That's right. That's right, it was. Because
so there might be some people thinking, no need to get that flu
but
vaccine.
The reason flu was quiet is that we were staying home a lot, we were masking a lot, we were being, I think, extra careful with washing hands and lots of other things, and we've seen some of that activity relax, and we definitely are expecting to see a flu season this year. And so to that point, the city is standing up some of the larger city college sites on Saturday, October 16, and then again Saturday, October 23rd, both as a family flu and as a COVID vaccine clinic. And we will have COVID primary series, but also Pfizer boosters at those larger locations. So just, let's get flu done, let's get COVID boosters done. All right, let's get to your questions.
All right, as you said, lots of booster questions. The first one from Stephanie from Facebook, which you've already addressed, but just to re-emphasize, Stephanie says, I got my COVID booster yesterday and was told it had to be 6 months after the first shot, not the second. Can you clarify?
Yeah, it should be after the second shot. And thanks for that. I know there's been a lot of just generally confusion about this. If you got it, if there was a little bit of confusion and you got it a little bit too early, I don't expect it to be a major issue. But the recommendation is to get it 6 months. I mean, it won't be a major issue. Not that I don't expect it to. It will not be a major issue. However, the recommendation is for 6 months after completing the primary series, which means at least 6 months after that second dose of the Pfizer vaccine. And I anticipate we will see similar timing recommendations for Moderna and J&J coming shortly.
All right. Alex from Facebook. I just had the shingles vaccine on October 5th. Would like to know, can I get the booster next week on the 13th?
Yes.
If not, when could I receive the booster for Pfizer?
Yes. Okay, good question. Early on in COVID, when COVID vaccines were first available, we advised to space out, to not be getting another vaccine at the same time, because with the new vaccine, you want to make sure you're not seeing unexpected issues. But now that we have given more than 6 billion vaccines or COVID vaccines around the world,
wow.
Yeah, 43% of the world has gotten a first dose.
Amazing.
The U.S. is now in like 48th place, though, in terms of vaccine coverage. So we could talk about that if interesting. But anyway, the point is there's been a lot of vaccine that's been given, and there's been a lot of vaccine that's been given in conjunction with other vaccines. And so you absolutely now, the CDC has no spacing recommendations for any vaccine with the COVID vaccine. So you can get first, second, or booster COVID vaccine at the same time as you get a shingles vaccine, at the same time as you get a flu vaccine, same time as a child is getting a routine vaccine for school, The only thing is typically they'll give one in one arm and one in the other. They should be given at least 1 inch apart if for some reason you can't use one arm. And of course, if you want to space them out, you can, but there is no need to. And in fact, at the clinic that we were doing just the other day at work, we had a lot of people get their flu vaccine and their COVID booster at the same time.
Wow. It also just emphasizes how much we've learned.
Yes.
Because so many people
That's right.
are vaccinated, and,
That's right.
and we've been
That's
looking
right.
and studying the whole time,
Yeah.
right? So we know so much more.
That's right. And there are some countries, just sort of to this point, that are basically almost fully vaccinated, like where at least among eligible residents. And it's countries like Portugal, it's some interesting countries that are literally at 98%, and they've been able to drop COVID restrictions.
Wow.
Like drop them, And so we're not there. We still have a lot of people, somewhere in the 650,000 range, we estimate right here in Chicago, that have not been vaccinated and don't have any evidence of antibodies in their blood. So no evidence of prior COVID and having recovered. We get a lot of questions about quote unquote natural immunity. We know that there is certainly some protection after someone has recovered from COVID. The best protection out there is when you've both recovered from COVID and gotten a vaccine. That gives you really, those are some of the best studies I've seen where they've shown that your bone marrow is really ready to go in that setting. Best in my opinion is that. Next is people who have only been vaccinated, and next, but still with some protection, would be people who had COVID earlier. But we do studies. This is done across the country where you look at people who there are blood samples for other reasons. So maybe they're giving blood, maybe they're getting blood tests. Otherwise, it's anonymous. But you look to see what percentage of the population has antibodies, and you can actually see if they're antibodies from vaccine or antibodies from natural infection. And so we can use that data to estimate. And the problem is here in Chicago, there are still about 650,000 people who have no sign of antibodies, either from vaccination or from natural protection. And that is more than enough to potentially cause trouble yet this fall. So,
Okay. All right. Brady from Twitter. Is the dosage amount for the Pfizer booster the exact same as the first and second dosage amounts?
Yes, another good question. It is. That may not be the case for some of the other things that are may be coming out here. So it's possible the Moderna booster, for example, may be a slightly lower dose. The Moderna initial series was a little bit higher, actually, than Pfizer, and the booster may be a little bit lower. But for adults, for the Pfizer booster, it is the exact same. So it was the same dose for the first, the second, and the booster. Now, let me just clarify, because for children, just today, Pfizer officially submitted its data to the FDA for 5 to 11-year-olds. And in that case, it's the Pfizer vaccine, but the dose is 1/3 as great as it is for people age 12 and up. And that was done, again, studies really looking at what is the amount that's needed to produce the appropriate antibody level. recognizing that, obviously children are smaller, the dose is, is less, and not wanting to have unnecessary inflammatory. We have seen that people are more likely to have side effects when they have a really robust immune response, right, all along. So it's one of the reasons why older people, less likely to have those side effects with their first and second doses of vaccine, but also then a little more waning, and that's why the booster is being recommended. People who, when they get their first or their first and second dose of vaccine, have that short-term, 24, 36-hour really not feeling well, that's actually a sign they have a very good, robust immune system, and that tends to be people who are younger. But what that is, that's not COVID, to be clear, that's your immune system learning how to fight off COVID. And particularly with the teenagers, where very rare, but we were seeing occasionally with the inflammation, for example, some inflammation of the heart muscle, this myocarditis, which people recovered from. It's not something that had long-term effects, but nevertheless, lots of interest in thinking about wanting to make sure doses were as low as they could be to limit inflammation, to limit side effects while still giving the protection. So that will actually be a different dose, is what Pfizer is proposing for the younger kids. And so obviously we'll share more about that as it's more available.
Right. Next question, still boosters. Brady from Twitter, is the dosage, oh no, I just did that one. Sorry, Brady. We already answered your question. Jenny from the block. If I got my first Moderna vaccine on April 30th and no second, do I have to start over? Will my next vaccine, getting it tomorrow, be considered my first since I waited so long, or is my first vaccine still active and my next vaccine will be considered my second?
All right, good question. Your first vaccine still counts. Your second vaccine that you are getting, even though you're getting it later than recommended, is considered your second vaccine, and you would be considered to have completed your primary vaccination series at that point. And the CDC actually has specific guidance around that. So I'm not just making that up. Really, the recommendation is to get it, in the case of Moderna, 4 weeks later. But, I'm not sure what was happening with you, but something, where you didn't get that at that time. I'm very glad you're getting it now because we have seen that it's important for those mRNA vaccines, which is the Pfizer and the Moderna, to get both doses. Being partially vaccinated is more protection than not being vaccinated, but every single week we're showing you how much more likely it is that people are getting COVID if they are unvaccinated. How much more likely if they get it, that they're getting hospitalized, dying, et cetera. But for people who are partially vaccinated, the risk is lower, but it is still substantially more than with the 2 doses. If for anybody out there who's like, I'm only going to get 1 shot, I still have some patients who are like, I'll get 1 shot, period. J&J is still the best one if you're only going to get 1, because that's been shown. If you're going to get 1 shot, that's the one to get. If you're going to get the highest protection, that mRNA is there. And frankly, some of this Johnson & Johnson booster with what I expect, we'll see, but I expect there will be a recommendation for a booster for J&J that will bring it right back up to the level. So I don't want you worrying, oh my goodness, I got this one, oh my goodness, I got this one. Make sure you've gotten your full series. I had 2 doses of Pfizer. I'm very happy that I got Pfizer. If I'd gotten 2 doses of Moderna, I'd be very happy that I got Moderna. If I got Johnson & Johnson, I'd be fine with getting Johnson & Johnson, but looking at sort of booster recommendations.
Got it. And then here are 2 folks asking the same question, Lisa Adams and Estella Balderas. Do you know when the Moderna booster might be approved and available?
Okay, so like I said, October 14 and 15 is when the the advisory committee to the FDA will be meeting to look at booster data for Moderna and J&J. First, they look at that data. That's all publicly available at that point. You can even watch the meeting if you're interested online. The FDA then makes its formal recommendation about whether whether to authorize a booster dose. And then the CDC, the Advisory Committee for Immunization Practices, meets again, looks at the data, and basically refines the FDA. So the CDC is who gives the details of what should the timing be, exactly who should be eligible, how does this fit in with other vaccines, and it's always like that. That's not any different for the COVID vaccine than it is for any other vaccine. And so the ACIP, the Advisory Committee on Immunization Practices, meets, and then the CDC makes the formal recommendation. That process we've seen during COVID usually takes sort of a week to a week and a half, maybe 2 weeks. So I am anticipating, if everything goes as planned, we will have guidance for people who got Moderna on boosters and booster timing before the end of October. But we're just going to have to see what the data says and what the FDA and the CDC end up recommending. But either way, we'll have more to share with you just in the next few weeks.
Gwendolyn Rose from Facebook. There have been some deaths among those fully vaccinated. Can you discuss? Are these cases individuals with pre-existing conditions?
Yeah, so good question. First, let me just start by saying we are seeing so many more deaths in people who are unvaccinated. That is by far the biggest risk factor. You know, it's about, depending on which week you're looking at and which location, if someone is infected with COVID and they are unvaccinated, their risk of dying from COVID is 11 to 15 times if somebody is fully vaccinated. But we have seen a few breakthrough deaths. Here in Chicago, I can tell you still 99% of the people who have been vaccinated for COVID-19 have not had a breakthrough infection with COVID, okay? 99% have not even had an infection, 99.9% have not been hospitalized, and 99.99% have not died. So we're talking about a very small number of people. But I can tell you who those folks are that we're seeing breakthroughs on. So here in Chicago, where we see breakthrough hospitalizations, again, 99.99% we're not seeing a breakthrough hospitalization, or 99.9% we're not seeing a breakthrough hospitalization, but in that 0.1%, it's people who are older, the average age is 68, very likely to have an underlying condition, especially immunocompromised. And then that's even more true for people who die, right, who were vaccinated and die. I can tell you the average age here in Chicago of people who have died from a breakthrough COVID infection, the average age is 78. So half of those people are really over 78. That's, this is part of why that booster recommendation is being made for people over 65. And really all but one have very clear underlying conditions. The only one we don't know about underlying conditions in is because died at home, and we just there are not medical records. There was not a workup there. But besides the one that died at home and was found by the medical examiner to have COVID, that was a test. The rest have underlying conditions and severe underlying conditions. The most common 40% plus have a severe immunocompromising condition. The most common thing is active cancer. People who are getting chemotherapy right now, really, these very high risk people. And we know that especially for people who are immunocompromised, the vaccine, yes, people should still get vaccinated, but sometimes the vaccine is not as effective. So we've not seen anything out of the ordinary here. This is similar to what we've seen around the country. But one of the reasons we're really encouraging, if you're over 65 or over 50 with an underlying condition, get that Pfizer booster. And then for the folks who got the other ones, Moderna's looking really good. Don't worry, you're well protected. I don't want you sort of saying, oh no, it's a couple of weeks. But anybody who has that immunocompromising condition already was recommended, to get the third dose.
Yeah. And even before talking boosters.
Even before talking boosters, that's right.
Get vaccinated.
They get vaccinated, yeah. The most important thing, and I know we say this a lot, but like, if you're really worried about should I get a booster, or like why can't I get a booster yet, the most important thing you can do is try to make sure everybody in your social network is vaccinated. And if everybody in your social network is vaccinated, meaning the primary doses, that is even more important than than the booster, although it is also certainly recommended for people who are at higher risk of those breakthrough infections. But the vaccines continue to perform beautifully against those severe outcomes.
Kevin Lamana from Facebook, thank you for your continued communication. Is CDPH tracking a specific vaccine type, Moderna, Pfizer, to respective breakthrough cases? And is there any plan to add breakthrough case data to the public dashboard?
So we are tracking it, and we report it to CDC, where you're seeing these national numbers. You really want to look at a question like that sort of nationally, because there are different patterns in terms of which regions, which groups might have had which vaccine. So I can tell you that we have seen breakthrough infections related to all 3 vaccines, but most of this is about what we've seen the most people being vaccinated with. So for example, we've seen more breakthroughs with Pfizer, but we've also had more people vaccinated with Pfizer. And so not seen anything hugely concerning there. We have seen some more breakthroughs, I think at the country level, a little more with J&J than with the mRNA vaccines, which is one of the reasons we're looking at the booster for that. Again, the protection against the hospitalization and death, continues to look good. So, yeah, hope that answers it.
Paula Gatto from Facebook. Only in 2021 do people defend a vaccine that doesn't do what it is designed to do, but still blame people for not taking it when they are just as if not more likely to spread the infection.
Okay, so
a couple pieces there.
So first of all, my goal is not to blame anybody, and I hope that as you're having conversations, with your friends and family who may not be vaccinated, this is not a blame conversation. It's a exploratory conversation about why people haven't done it yet, what questions they have, what concerns they have. Because if people have, at this point, with it widely available, have chosen not to do it, people are making that decision with what they believe to be best for their health. And I want to understand why they feel that's best for their health, make sure they're getting appropriate information as they make that decision. But on the second part of the question about implying that people who are vaccinated are just as or more likely to spread COVID, I got to push back on that because that is just not true. Let's kind of walk through that a second. So you can only spread COVID if you get COVID. You cannot spread COVID if you've been vaccinated. For example, I get vaccinated and I'm near you as a vaccinated person and you get COVID from me. No, you can only spread COVID if you get COVID, okay? So first and foremost, remember what I said a minute ago? 99% of the people here in Chicago who have gotten fully vaccinated against COVID, 1 dose of J&J, 2 doses of Pfizer, 2 doses of Moderna, 99% of those people have not had a breakthrough infection. So by far the most important thing when it comes to spreading COVID or not spreading COVID is not getting COVID at all. And the most important thing you can do to protect yourself against getting COVID is getting vaccinated. So there's that. I think what you're referring to is that we do see some breakthrough infections, right? And so people who get a breakthrough infection, there's no such thing as a 100% protective vaccine, right? At the beginning, some of these vaccines were in the 90%-ish protection range, which is great. That's still a 1 in 10, chance that if you're exposed to COVID, you could potentially get it. And so those people are infected with COVID, and yes, there is some potential that they can spread COVID. However, even that is decreased because they are much less likely to have more serious symptoms, but also their time that they can potentially be infectious is shorter. And so at all points there, it's not a true fact that being vaccinated makes you more likely to spread COVID. In fact, it makes you much, much, much less likely to be infected with COVID. And then even if you were to have a breakthrough, your chance of spreading it is still lower than someone who is not vaccinated. So I hope that helps kind of clear some of that up.
Lakeisha O'Brien from Facebook. I recently got the first dose and now have an ongoing cough. I'm now afraid to take the second dose. Why won't this cough go away? I did not have a cough before I got the vaccine.
Okay, so a couple things. One is that there's a lot of things that can cause coughs, especially this time of year, other viruses, et cetera. Cough is not a common side effect we see with this vaccine. So if I hear somebody saying, I've had a cough that won't go away, to me, that says, depending how long this has been, if it's been a week, week and a half, 2 weeks, that's very common to sort of get a cough this time of year with a lot of the other viruses, just the regular respiratory viruses that are going around. But if it's getting worse, not getting better, if you're having fevers that are accompanying it, or it's just going and going and going, you should see a doctor. Not assume that this is related to the vaccine. And sometimes I see people have real medical issues and think that it's related to the vaccine. The vaccine, the side effects that we see related to the vaccine they don't go on for weeks and weeks, okay? Like the side effects that we're talking about are, in the 24, 48 hour range. So if you've got something that's going on for a week or two, that is not related to the vaccine, generally speaking. And I would want to make sure you are, getting a workup if you need it for a cough. But most people this time of year who are getting a cough have, another viral infection.
Okay. Alexandria Deanne from Facebook. I know someone who tested positive for COVID and is experiencing some symptoms. How long do symptoms usually last with a COVID infection? Is it different if the person is fully vaccinated?
Yeah, okay, so that's sort of what we were just talking about. Yeah. So when somebody gets infected with COVID, whether or not they are vaccinated, we use the same time frame for the amount of time that they should isolate. So if, do you know what that time is? Do you remember?
It's either 10 or 14.
Exactly, it's 10.
Okay.
And this is why I was testing you, because this is one of the things that, that has changed a little bit at different points.
Yes.
It's 10 days. So if you are diagnosed with COVID, regardless of whether you're vaccinated or unvaccinated, the huge majority of people are unvaccinated who test positive for COVID, but we do have breakthroughs. We consider you to potentially be infectious, to have been spreading COVID, starting 2 days before your symptoms began, or if you didn't have symptoms, say you got tested at work or school or something, 2 days before that positive test. And then we want you to isolate for 10 days from when your symptoms started, from the positive test, assuming that your symptoms have then resolved. In most cases, the people do resolve within the 10 days. And certainly for people who have been vaccinated, in most cases, they resolve within the 10 days. If you're still having symptoms and you haven't seen a lot of improvement at 10 days, you're not done isolating at that point, right? But if you're still pretty sick at 10 days, you definitely need to be seeing a doctor because you might be needing a hospital. This could be a little more severe. But yeah, generally, we see most people have symptoms that are a few days long, but there's a lot of variability, especially for people who are unvaccinated, and sometimes it can go on for a long time.
All right. It looks like we're at the
already
at the end. We went through a lot of questions though today.
Good.
Do you have any good news? Do we still do that?
We do that from time to time. I think, for me, good news is seeing the progress we're making around the world on vaccination. There are still a lot of countries that have not had the access to vaccine that is needed, but we're definitely chipping away at it. And so, having crossed 43% of the world's population is really good, because getting folks vaccinated, whether that's here in Chicago or around the world, that is first, it's good for protecting, obviously, individual people and families around the world, but it also is what helps stop the spread of variants. Because variants develop, the virus has the opportunity to mutate every time it spreads. That is how it mutates. So if it is having fewer opportunities to spread because more people are vaccinated, we are much less likely to see the emergence of other variants. And a lot of people's questions about, am I going to have to get boosters forever, et cetera, et cetera, et cetera. All of that is tied in really to variants and kind of what happens there. So I've been pleased to see that progress. I've been pleased to see the U.S. Put a lot of even more resources and vaccine toward that international vaccine effort. And it's great to see some countries that are pretty much through COVID in the safest possible way now, where they're almost fully vaccinated, and we're unlikely to eradicate COVID. So at this point,
I was going to ask, do we think it's going to be a little bit of a cycle?
It's going to be, how we've been seeing these up and down. I expect to keep seeing these up and downs like this, and probably, unless there's some other additional major breakthrough. With a medication or something, I anticipate that it's going to be here with us. And so at some point, probably everybody or just about everybody is going to sort of learn that their immune system is going to learn the lesson from COVID. And either that'll be from getting COVID, which is the much riskier way, or from getting vaccinated. But the hope is that, I was talking to somebody last night, when we look at the 1918 flu, we didn't have the vaccines, we didn't have oxygen, we didn't have the ability to intubate people, ventilators, there was a lot of stuff we didn't have. And, it went on for about 4 years, and then eventually sort of got to a point where everybody had kind of been exposed. And because we have so much more ability to treat people, but then especially we have such a safe and effective vaccine, there is the ability to sort of get through it without as much illness and death. And so I'm very pleased to see more countries having more access to that, because it's the most important thing in terms of getting past this sort of economically, but also getting past it from a variant perspective and getting past it from, not having unnecessary deaths. So.
Right, I was going to say these hospitalizations and deaths are preventable.
Yeah, most of them are. Yeah. Most of them are. So anyway, so that's good news for me that we're seeing that progress. And I want the U.S. to come back up, right? Not be like 50th in the world, even though we have by far the most vaccine here. Yeah. We've had some more politics inserted into our conversation than we have in some other parts of the world, I think. So.
Yeah. Well, right here in Chicago, we'll be focused on that 77 goal.
Exactly. And even more, hopefully.
And even more. And I know that you often lift up those communities that have been inching forward.
Yeah, we did that on Tuesday.
Yes.
Yep.
Yeah. So protect Chicago, 77 strong.
That's right.
If you've been vaccinated, share your story. And support others in getting the information that they need to do the same. Yeah, we've got a new senior vaccine campaign kicking off, and you might see it. It's playing in prime time. It's playing on Wheel of Fortune. It's all over the place. We'll show you a video from it next week. But it's about not just getting vaccinated yourself, but helping others get vaccinated. And Chicago's been good. We want you to keep it up. Next step is, taking that 77 pledge and saying, I'm going to help this city get there. And every neighborhood continues to have room to grow. All right. All right. Great to be with you. See you next Tuesday. You too. Thank you. I feel so honored when you come back. We will be back on Tuesday with more updates. And be safe. Protect Chicago.